Hello everyone, my name is Jason Laird, and this module will be concerned with MCQ Writing Guidelines. It's a brief introduction to how to write quality multiple choice questions. Here's today's learning objectives. These 5 objectives are concerned with a brief overview into how to begin to write quality multiple choice questions. It's a subject that could take quite a bit of research and understanding to master, and today's just serving to try and help or orient you to beginning to write quality multiple choice questions. Multiple choice questions were first used way back in the 1950s on medical exams because they were found to have greater reliability than essay exams. It's one of the most well-researched testing methods, and it's one that we all know very well from all areas of medical testing and credentialing processes. So if we're going to talk about reliability as one of the main reasons that an MCQ question should be used, we should probably know what reliability is. So reliability is defined as how well a test consistently measures a learning outcome. Well-designed multiple choice questions are less prone to guessing than you might find in something like a true and false question, and that's what helps make them more reliable. Well-designed multiple choice questions are less guessing than you might find in all sorts of other types of testing. And the reliability can be increased because of the number of questions that can be included in this. So not only do you have a more honed reliability in the answers of the question than you would a true-false, you can actually increase the number of questions and start to hone in on a more reliable test to serve your single learning objective. Additionally, reliability is enhanced by the objective scoring that the tests have, which eliminates a lot of the subjective scoring and the inconsistency that's related to subjectivity. So when writing multiple choice tests, we can also talk about validity. And to separate validity, here's the definition, which is it's the degree to which a test measures a learning outcome it's intended to measure. So because students can cover many multiple choice questions quickly, a large representation of the course material can be covered, and this is thereby increasing the validity of this exam. So there are many sources for guidelines and research into how to construct quality MCQ questions. Next, we'll be looking at a list that's an overview of how to write quality MCQ questions. So here's some intro into some basics when it comes to MCQ constructions. Each of your questions should focus on a single written objective. This helps to increase that reliability and validity that we just talked about. It also, by focusing on a specific written objective, it eliminates confusion on the test taker's part. Make sure each question can be answered without looking at the options. This will help you construct a more quality MCQ question. And a suggestion to do this is to consider it like a true fill-in-the-blank or short answer question that you're more familiar with, and see if you can answer that question without listing the answers first. And then no multiple choice question should be tricky or trying to be overly complex. We don't want the students to be confused. We want to measure learning outcomes. A few more basic guidelines. Don't paraphrase textbooks because plagiarism is bad. It also, if the students have read the material, it can help them guess by memorizing the book material versus understanding the learning objectives. And then, of course, all questions should probably try and adhere to any proper grammar, punctuation, or spelling that would be appropriate for the test. And now we're going to move on to STEM creations. So when writing question stems, attempts should be made when possible to focus on problems that would be found in clinical practice rather than assessing the student's knowledge of facts or just obscure things. Additionally, using questions with context or within a medical context, such as patient scenario listing, their age, the questions that we're familiar with from board testing style questions. This actually has been found to stimulate higher level thinking and also demonstrates the student's problem solving a little bit better than it would without context. So here's some STEM writing guidelines. First, include as much of the relevant information in the STEM and try to leave out anything that you don't need. Positive statements should be focused on, with avoiding any negative phrased items if possible. And then, of course, trying to avoid which of the following is true and which of the statements accept. It's things that we've all seen in these tests, but they're not the best questions, and they don't stimulate higher levels of thinking as well as we would hope they would. We should rotate the correct answer through each of the options, and it should be done randomly, and they should be in each option item at least hopefully a similar amount of times. And the stem should be a complete question or a partial sentence. The complete question is preferred. Any additional complexity, leaving blanks, things like that actually requires an additional cognitive load and takes away from the focus on adhering to assessment of the learning objectives. So when we talk about options, what are the guidelines for this? Well, here you are. As far as the answer options, we want to word them as clearly and concisely as possible. We should use only plausible distractors that are the same relative length as the actual answer. And we should really focus on trying to review and assess our distractors, making sure that we remove any ineffective or wasteful distractors, because they lessen the reliability and validity of the test, and they also increase the cognitive load on the student. Each test question should have only one correct and clearly best answer. Write the options that are grammatically correct and list them in a logical order if that's possible. And we shouldn't use absolutes in these test questions. We're in medicine, and there's very few times that anything is an 100% absolute, and we don't usually use never or always. And so we should probably try and leave that out of our test questions. And using none of the above or all of the above should be avoided. Keep your options mutually exclusive, making sure to avoid confusion if you can, or any overlap. Keep your test questions homogeneous in content. Try and focus on that learning objective, keeping all of the options similar and plausible. Avoid any intentional or unintentional clues as to what might be the correct response. And now we're going to move into a little bit greater depth on one particular topic which I found interesting, which is how many distractors should we use when we're picking these test options? Traditionally in medicine we see 5, and then we also see questions with 4 and sometimes with 3. Well, how do you know which is the best? Well, a lot of this comes down to functional distractors. And we need to understand the concept of a functional distractor to know how many are really necessary as far as options within our test to gain that reliability and validity that we're seeking. So the traditional definition of a functional distractor is an option that's chosen by at least 5% of the students that take the exam. So in order to assess this, you really have to go back and review your test items and the test performance to understand what is a functional distractor and to be able to remove those ineffective distractors that are in your test. So taking a deeper look into research from the past is that 4 and 5 option MCQs are seen in health disciplines, but the reality is that 5 option tests have no benefit over 4 option tests. And it's been found in research that 5 option tests often have non-functional distractors, basically space fillers. There's also now research showing that 3 option tests can function without any loss of reliability and validity in the test. And this is in comparison to 4 or 5 test question options. Interesting to note that by reducing the non-functional distractors and reducing the options down to 3, but making sure that all 3 test questions are functional distractors, it's been found that this can reduce the time the student spent taking the exam on the same number of questions by up to 16%. And a correlation to this is 16% more test questions could be included in your test to broaden the focus of the test and ensure we're really getting a focus on the learning objectives. So increasing both the reliability and the validity of the test. So when we talk about making the decision of how many options should I choose, should it be 3 based off of some of the most recent research? Should I use 4? Should I go with the old standard of 5? The reality is that the key to using this should be directed by the principles that we've gone over and the guidelines for writing quality test questions. Each question should focus on the objectives, and each number of the items should be determined by the number of functional distractors by review of your test results. The test creator can consider that not all test items must have the same exact number of choices on every test question, assuming that each distractor is functional and plausible in your test. Consider varying it, maybe having 3 on one question but 4 on another, and continually review and hone your test to make sure that each question serves only plausible and functional distractors. That's all we have here today regarding the initial overview for multiple choice question writing. I would highly recommend a deeper dive into any of the areas, both STEM creation, option creation, and the number of choices, as there's much reading, much more than what I could include here in today's module. Here's an initial lineup, and if you'd like a little bit more deeper read, these references provide much more information that was included in this lecture. I appreciate your time and attention. Thank you so much, and thanks for being a part of this class with me. Bye-bye now.